Hello, I'm going to talk today about low-dose lithium for depression and also low-dose lithium to prevent Alzheimer's. And before I get started, I'd also like to spread the word that we are all low in that hormone called vitamin D. The reason I am white is because my ancestors were from Europe, and you make vitamin D partly when you're in the sun, and you needed to be white to make enough vitamin D in the summer to get through the winter. And none of us are out there as hunter-gatherers anymore. So we're all low. Now, I am Robert McMullen, MD. I'm a psychiatrist who's been doing psychopharmacology for over 30 years. I went to Georgetown Medical School and Columbia Psychiatry residency. And I also do TMS, transcranial magnetic stimulation, which is FDA approved for depression and probably will be soon approved for OCD, and it works for a number of different neurological and psychiatric problems. Now, lithium helps out depression. Usually people have a negative attitude about lithium because the people in their neighborhood who the police have to come and get because they're manic or they ran down the street without any clothes on, which probably means they're manic. Those people are on lithium, but that's bipolar 1 disorder. That's manic depression. And some of them are repeatedly out of control, and everybody knows they're mentally ill, and everybody knows they're on lithium. There are a lot of them, however, who are doing excellent, and nobody knows they're on medication, and they do fine for years or decades. But the only thing we know is what we see. And if we see people that are out of control and we associate that with a certain medicine, then that medicine has a negative connotation. Now, somebody who's bipolar 1 manic depressive might use 1,200 milligrams a day or 1,500 milligrams a day. But for depression, very small doses work, even 150 milligrams per day. And my psychiatrist, who's a good deal older than me and taught me everything I know over the last 35 years, or he contributed it, said, why are you only giving 150? It works better at higher doses. And I said, well, 150 often works. And if I give 150, a person has no side effects, almost always. And so far I've had 52 people that within 2 weeks of adding it to whatever they're on had a surprising benefit. They were surprised, I was surprised. These were people that aren't typically placebo responders. I know them very well. And 10 days after they started it, suddenly they just felt better. They felt more resilient. And realized that they were a little below normal in their mood. And then if the person I start at 150, if they have a big dip at some point and they go into more depression in a couple of months or 3 months, then I can always edge it up and go to 300 or 450 or something like that. But the interesting thing about lithium is that in low doses, it's like a different medication than the high doses. And Phelps, in his book, A Spectrum Approach to Depression, goes into this with a wonderful explanation and references. In these low doses, you usually have practically no side effects, and you have a nice antidepressant effect. If you go to high doses, if you go, say, 900 or above, then frequently it won't work. So manic depressives don't have much benefit for their depression. It stops their swings, but then they may be left flat. They may be left below normal. And the lithium doesn't bring them out of that in those higher doses. But in low doses, it's a very good antidepressant. I have a few people who, after a year or two, seem to be much different since they were on the lithium. For example, I have one person, a professional who's in her early 60s, who said to me that she was amazed when she realized that she hasn't had any depressive episodes in a year. I didn't even know about these, but even when she's been doing very well on antidepressants, about twice a week she would have depression sweep over her in the most painful way for about 10 minutes only. I guess that's why she never mentioned it. But ever since she was a teenager, so for over 40 years, it would just be an unbearable feeling of depression, and then it would go away. And she suddenly realized she hasn't had a single one in a good year, and maybe it went back farther. It's hard to remember, the 6 months or a year before that, whether they were getting less frequent or what happened. But she knows for a good year she hasn't had them. And we started the lithium 150 milligrams exactly 2 years ago. She says there's another difference, is that her bottom isn't as low. So maybe most of the time she's up around normal, but then sometimes she'll sink and maybe down to 10% below normal. But now she feels like, if she goes down, she goes to 5%. Whatever it is, it just doesn't seem like she has these mild dips quite as deep as they were before. She feels overall better. She's a good example to give because there's something measurable how often she has these attacks of brief depression. With other people, it's harder to say definitely, but somebody I've treated 30 years, when the last couple of years, they've just been more calm, less worried about work, just handling things better. And they're just different than they were. And they've been on the lithium for 2 years. So it's a very important thing and should be used a lot more. And even 25 years ago, a friend of mine, Joel Hoffman, said that when he sees a new patient, he always puts them on 150 of lithium right in the beginning, if they'll do it. A lot of times it's a big argument because of this negative connotation. And then if they sink and they have worse depression on down the line, they won't be so adverse to going up on it. And I think that that's absolutely true. And many of us are now surprised that even the 150 helps out so many people. And I have a couple of elderly people that, well, they don't seem so elderly now because I'm about their age, but on just 2 or 3 per week, it made a major difference. Now, there's another important thing about lithium, and that is that it prevents Alzheimer's. And I am just astonished that so few people know about this. Some 25 years ago, somebody noticed that certain counties of Texas were very low in Alzheimer's disease. And then somebody noticed that these were the counties that had a lot of lithium in the drinking water. I wish I could find the whole history of this. I've kind of searched for it. I'd like to know who they were and how it all came about, because I'm sure it's pretty interesting. But on the internet, they have so many other things about lithium and dementia that it's been hard for me to find the actual history. Now, and then subsequent to that, there's been some research, and other parts of the world have the same result. Only a few months ago, there was a report from Denmark, and they took one part of Denmark that was high in lithium and another part that was low, And they compared the Alzheimer's rate, and sure enough, the Alzheimer's rate was less in the area that had more lithium in the water. And there's been about 3 studies, I believe. And one study, which I think was about 8 years ago in the British Journal of Psychiatry, gave only 1 milligram per day of, I believe, of lithium to some people with mild cognitive impairment. These are older people. Mild cognitive impairment is an official diagnosis now, and it's not Alzheimer's, but a lot of these people convert to Alzheimer's. So the half of people that were on lithium, that they put on lithium, had a lower conversion rate to Alzheimer's than the ones who did not get the lithium. And there was another study, I believe, on people with early Alzheimer's that it prevented a decline in cognition when they put them on lithium. And I think there was a third study, but I have a little summary of all this called the bottom line of lithium in Alzheimer's, and it should be on my website. I had a personal experience with it. I had a lady with Lewy body disease, which makes up about 5% of all dementias, and lithium is a good, Alzheimer's is a good 90%. And Lewy body is very similar in that people go downhill very fast. In a year or two, they might be in a wheelchair, and they die within 4 or 5 years as the brain deteriorates and hits the breathing centers and so on. The problem she came in for was being very depressed and also having some Parkinsonian symptoms. And we treated her with TMS, and I also gave her 150 milligrams of lithium per day. And gradually her depression got better and her Parkinsonian symptoms got a lot better. We used a special helmet designed for Parkinsonism. And she was much more cheerful and less afraid and did really well. And then after a year, there was some discussion about whether to reduce the sessions to less frequently or stop. I forget what the discussion was with the family. I believe she was just having the treatments like twice a week or so. And then I did a mini mental status exam. And the mini mental status exam is a classic exam given to measure the degree of Alzheimer's that someone has. And her exam score was the same as it had been a year before. Or maybe it was 1 point higher or the same, but it's basically the same. And that's really astonishing. And lithium prevents brain cells from dying, it prevents Alzheimer's, and perhaps it stalled the progression of her disorder. Or it could be that the TMS did it, because the TMS increases what I call the growth hormone of the brain. It's BDNF, which is brain-derived neurotrophic factor. And it's an omnipresent substance that you need to make neurons connect with each other and for the axons to grow and so on. And it prevents cell death. And it's very low in depression. And when you come out of depression, it comes up to normal. Sometimes it takes a while after you're feeling better for it to all come up. And both lithium and TMS dramatically increase BDNF. And that perhaps is why this worked. Maybe both of them did that, and that's what helped her from deteriorating.
I have a question regarding the lithium and depression treatment. Does it always need to be part of augmented treatment, or it can be as solo
That's a
medicine?
good question. Whether lithium can be used alone for depression or as augmentation only? I don't have a good answer to that. I think I have a few people that are on lithium alone, and they may be a little more like a bipolar 1, and then they're on 900 milligrams of lithium, and their levels aren't very high. But once somebody's stable, they can get by with much lower levels. The United States always gave people that were bipolar 1 high doses of lithium, and the Europeans found out that many people could do just as well on lower doses, which is much safer for your kidneys. But that's a good question. But usually depression is hard to treat, so usually one would need more than one thing, and then lithium would be the augmentation. Now, in this book, A Spectrum Approach to Depression, his main point in the book, although he covers all the medications and all the possibilities practically, is that the ideal combination is lamictal, lamotrigine, and low-dose lithium. And lamotrigine came out as an anti-seizure medicine in about 1994 all over the world, but immediately the neurologists saw people come out of depression. And so the next year, a few psychiatrists were using it, and the following year, 1996, I started using it, and it just changed my practice. That it's just such a huge number of people, usually with atypical depression, or being slightly bipolar, whatever you want to call it. Various degrees of things. Everybody's mood disorder is different. Did so well on it with no side effects. And then we thought you had to be on a dose of about 400 milligrams, which just put you into the level where you'd use it for epilepsy. But then the company luckily did a giant study comparing 50, 100, 200, and 400. And 100 milligrams had some benefit, but 200 milligrams worked as well as 400. So I brought everybody that was on 400, I brought them down to 200, and then their blood level was below what you'd ever need for epilepsy, for seizure disorders. And it works at this low level. Now sometimes people have to go a little higher, but you're on a very tolerable medication, and it works, and it keeps working when it works. And it's so safe you can go through pregnancy on it. If somebody's pregnant, I like to keep it really low or stop it, but a lot of times we might decide, I and the family, that maybe we'll just reduce the lamotrigine to 50 milligrams instead of 200, and then if she starts to get depressed, we can always go up fast. And of course, after the first 3 months are passed, you can give a woman practically anything, any medication, and it won't harm the child. Except tobacco's not a very good thing. It causes attention deficit disorder, and narcotics are not a good thing. But that is the ideal combination to shoot for. If the depression is really severe, you probably can't wait around on those two medicines. You probably have to use heavier duty things, but the goal ultimately should be those two things as maintenance if you can. And the lamotrigine doesn't work so quickly because the first 6 weeks you have to go up slowly to avoid rashes and to avoid a very bad rash called Stevens-Johnson syndrome. So you have to go slowly, and so therefore it's not going to work right away. Anyway, this is Robert McMullen, and I've just given a little explanation of using low-dose lithium for depression and ultra-low-dose lithium for dementia. Now for dementia, Alzheimer's prevention, with my patients, I want them to take 150 a day because it may help their mood. But with people who never had a problem with depression, they might be able to take 5 milligrams once a week, because that would average 0.7 milligrams a day, and since the lithium in the water is half that, 0.3, that 5 milligrams a week is probably going to lower the risk a little bit, although I think 5 milligrams a day is preferable. And you can buy the lithium on the internet in those tiny doses. It's called lithium orotate. It's just a different salt of the lithium. And I think people should start talking about this a lot more. And some experts have said if we could put some of this in the drinking water like we do fluoride, we might save billions of dollars, because Alzheimer's is an incredibly expensive illness. Thank you very much.
Thank you, Doctor.